should we start to insist that all MDS patients must have a genetic mutation test to establish what treatments may work out best for them?
So genomic medicine is very much the sort of happening field of cancer biology at the moment, and MDS is no exception. In fact, MDS has been leading the way because colleagues of ours published one of the very first what we call targeted sequencing papers in a cancer identifying a new mutation using this new technology that's available, a very powerful technology for interrogating all the genes now and identifying the new mutations. So we are moving rapidly forward in this field, and the problem now is not the ability to generate some data. The problem is actually interpreting the data that we have, in addition to trying to generate more data. So yes, we can tell from a set of mutations that we analyze which MDS patient has which mutations, but there are various technical reasons why one mutation may be relevant and the same gene mutated in another patient may not be actually causing the disease or problematic, or may not be present in a high enough quantity to be sure that that's actually relevant. So the more you know about this field, the more complex the analysis of the data becomes. And I think it's easy to take it all on face value and think that we know all the genes that are mutated in MDS, so we know a lot of the genes that are mutated in MDS, and therefore we now just need to work out for an individual patient which mutations they have, and it will tell us something new and helpful that we can use. Partly that's true, partly we can do that. We've identified some genes that confer a poorer prognosis, so the survival will be shorter if the patients have those genes. We don't know yet whether we can do anything about that, so we don't know. We don't have treatments that can necessarily reliably improve the survival if those abnormal genes are present. But we're working on that. We're looking back on large data sets to see if there are drugs that we have available now that can improve the outcome for people who have certain abnormal mutations in their bone marrow, in their MDS bone marrow. Whether every patient needs a genetic screen for routine management is debatable, but because there are relatively few drugs that we use that are actually able to target the mutations that we know are there. So if we have mutation X and we can use drug Y, we're not quite there yet. Some of us use the mutations mostly in terms of whether a patient should be transplanted or not, although we don't actually know whether that's the right approach. Many people don't use the mutation data because it's evolving. So I think we're in a phase where if you know a lot about it, on the one hand, you know what the limitations of the information are, but you also know the data, so you can give the patient some kind of feel for whether it's good or bad. But what's really important now is that we gather together very large data sets of MDS patients to be able to look at the complexity of the genetic changes, and they are very complex. So we're up probably now to about 140 genes that are known to be mutated in MDS, and would fit with a panel that we could use to identify the combinations in a large trial or research context, and the number is increasing all the time. And so at the moment, I'd say yes, it's nice to have a genetic test for all patients who have MDS, and we do here, but we don't always know what to do with it. We don't always tell the patients about it because it would only serve to confuse, and I would only tell the patients in detail about it if I thought that it actually influenced the discussion about the treatment and the prognosis, and that doesn't happen very often.